Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. Today, gas stoves, a major study looking at the impact of replacing gas stoves with electric ones in the homes of people with asthma, was cut short when federal funding was canceled, but not before researchers found promising improvements in health and indoor air quality. Stephanie Desmon talks with Johns Hopkins researcher Anna Rule about what the study revealed and what questions remain. Let's listen. Anna Rule, thanks so much for joining me.
You're welcome. Thanks for inviting me.
So we've heard a lot about gas stoves over the last few years. Why have they become such an important topic in public health?
Because little by little, we have been gathering data and information on the releases, the environmental impacts of the gas stoves and the health effects. And so we didn't have that information, years ago. And in some situations, gas stoves had turned out to be better, for example, than cooking with a wood-burning stove. And so we had moved in that direction until somebody realized, wait, let's see what's being emitted from the gas stoves before we completely put all of our chips on that. So that's one of the reasons I believe you have heard more and more over the years.
So what pollutants are you most concerned about? And what do you know about how this stuff affects our health?
Specifically, nitrogen dioxide. Turns out that burning gas particularly emits NO2, nitrogen dioxide. And as we have tools to measure that in the air, we have compared homes with gas and without gas stoves and realized that the nitrogen dioxide in the homes is significantly higher in the homes using gas stoves. And NO2 is an irritant. It affects your upper respiratory tract. And in people that are healthy, you barely notice it. Sometimes you may smell some, but it's barely noticeable. But in people that have trouble breathing, like asthma or other lung diseases, they really notice it. And that's how we have been learning how to measure it and how to learn about these health effects.
And it's making these folks sick.
It's making their sickness worse. Which is, I don't know if you understand, the difference is it's not clear that the NO2 is making you asthmatic. But if you're an asthmatic, the NO2 is making your sickness worse.
Is this only when the stove is on and in use, or is this all the time?
It depends. So definitely when the stove is on and used. But there are many parts of the plumbing system that may have little leaks. They are called fugitive emissions. And so it doesn't necessarily need to be on. Sometimes, if it's a very leaky old system, it can be just with a stove being present in your home.
So the reason I called you today, because a study led by researchers at Case Western Reserve had their research cut short after their EPA grant was canceled. Researchers were planning to enroll 1,200 households in a study where they were going to replace the gas stoves with electric stoves. I'm curious, you weren't involved in the study, but what were they trying to learn and why was this study important?
The study was important because a lot of the information we have is based on models. Like we have measured NO2 in homes. We have done it here in Baltimore. We have several studies where we have done that. And we know gas stoves NO2, and we know they exacerbate asthma. But it is really expensive to do the kind of study that these investigators were doing, in which you replace the asthmatic stove. You replace the stove in the home of a person that has asthma from one that is gas-based to one that is electric. So these studies are really expensive to do, and it requires a long time. The investigator develops a relationship with these patients. It is a monumental work. You have to have a huge infrastructure. So they're expensive, they're time-consuming, so they are not very common. What we do typically is based on smaller studies, we extrapolate. We infer that this is what's happening. So this study in particular was trying to get at that problem. Does it really help? Or is it just part of, or are we modeling incorrectly? And so this is the main reason this study was so important. And having a right sample size, that we call it, and a good number of individuals so that you can draw conclusions definitively.
So they planned to get 1,200 households, but they only were able to do 85 before their money was taken away. Even with that smaller group, they found fewer asthma attacks, fewer emergency room visits, and a 70% drop in nitrogen dioxide levels after the gas stoves were replaced. From a scientific standpoint, what did these early findings tell us?
This tells us that the effect is larger than we thought. Because the big sample size that you initially propose for a study is based on these assumptions, is what we know of the nitrogen dioxide and the effects. And that they got results with, I don't know, a third, right? Like 80.
Not even, yeah.
Yes. A fraction of the homes means that the effects on the asthmatic is even higher. It's bigger. There's more of an impact of a positive effect than we thought or that they thought.
So gas stoves have become surprisingly political, and some policymakers have promoted them as a matter of consumer choice, and others have emphasized their environmental and health impacts. As a public health scientist, how do you separate the evidence from the politics?
Everything that I just told you is based on evidence. I haven't mentioned the politics at all. So it is fact-based. Nobody's making it up. When you compare a home with a gas stove to a home without a gas stove, there's NO2 higher in the home with a gas stove. It is unfortunate that this has been politicized. That public health in general is being attacked because of our stance for science and for health above politics. And it is just the fact that the gas stoves are promoted by the oil and gas industry, I think, is what's making this politics.
If I am asthmatic and I have a gas stove, should I get rid of my gas stove?
If at all possible. That is the bottom line of this study. It is now, not all asthmatics are created equal. And I am not a pulmonologist. I am an environmental health scientist. So I do exposure assessment. In my lab, we have an instrument and we analyze NO2. So some of the data that comes and gets used in these studies comes from my lab, right? So I know that part of it. I don't know the health effects that much, but not all asthmatics are equal. Some asthmatics have a more chronic or more sensitive or worse asthma. And so, but the evidence is very clear. Definitely, for sure, if you eliminate that source, these asthmatics that were in the study improved. Their asthma improved. And so I think it's expensive, but if you can, you should look into it.
I was going to ask that. I mean, it's a real expense to go through that trouble, and not everyone can afford it.
Right. So one of the things you can do is maybe call somebody to look into your stove and make sure that it's, like as leak-free as possible. Yes, but definitely it's not trivial. It's not trivial to just get rid of your stove. I mean, in some cases, if there's no infrastructure, which is why this study funded by the EPA was so expensive, because you don't just need to replace one stove by the other. You need to have the infrastructure. So if your whole home is wired or, the plumbing is there for the gas infrastructure, you need to redo everything for the electric. So it's not trivial.
Why do you think the EPA stopped this?
Unfortunately, it is part of this political push. There's two things. One, these, I think, wrongly named cost saving, because in the end, it's going to cost people because they're not going to be managing their asthma. And then an attack on anything that seems like an optic that being related to climate change or to oil and gas. So unfortunately, I think there was a backlash. That's the belief.
Okay. I don't have asthma, and no one in my family has asthma. Am I safe?
The safe is such a complicated word. I think we haven't asked that question, or I haven't asked that question, right? How unsafe? But we know, like, NO2 is one of the criteria air pollutants. So there's evidence showing that NO2 or nitrogen dioxide is a risk to our health. Inhaling NO2 is not healthy. So there's definitely that aspect. So we know NO2 is not universally safe to breathe. So the evidence seems to point towards, yes, we should be getting rid of our gas stoves.
Well, I have one of those. The bigger story here is not about gas stoves, though. It's sort of about what happens when research is interrupted. And so what do we lose when a study ends before it's finished? Like, can those lost opportunities ever be recovered?
So I was talking a little bit about that before, right? So when we plan a study and when we write a proposal, people don't realize how much time and effort and, you'd have to have all of these background information, preliminary data to justify not just the expense. I mean, the expense is one big thing, but why do you need that many, right? Why the sample size? I am sure a huge effort went into deciding why 1,000, 1,200 were needed. And that is based on only scientific questions. How many are we going to need to tease out, for example, small differences? Like we saw these differences in people that had really, really bad asthma, but we lost the opportunity to find if there's even a small difference or people with not very severe asthma also had some effects. So some of the things that go into this sample size calculation also involve certainty. So the more people you have with these effects, the better you can for sure say that that's the effect. Like I was saying before, the effect is so big that we saw it even in a very, very small part of that calculated sample size. But we lost also all of that trust and relationships that the researchers had built with the community. They probably lost team people, right? So all of the research assistants, research associates, students that were working on the project, it's not just the researchers that are losing here or the participants. There's a big infrastructure of loss, I think.
What's the one thing you wish everyone understood about indoor air quality, but they probably don't?
It's really interesting. I love that question. So people sometimes don't think about this, how important air quality is. If you suspect that your water is not good, you go out, you buy water, you buy a filter, you change your water source. If you suspect that your air is not good, you cannot stop breathing. You cannot choose not to breathe that air. And so I wish more people understood how important air quality and the Clean Air Act are. And the Clean Air Act doesn't affect indoor air, but the EPA was making strides to at least try to address some of these indoor air issues because we recognize that indoor air is typically worse than outdoor air because the EPA over the years has helped us to reduce outdoor air pollution to a great extent. To the extent that now indoor air is most of the times worse than outdoor air. And so I wish people understood that. We need if we're not going to let big government come into our house and tell us what to do and what not to do, then we need to be aware of how important breathing clean air is. And especially for people who have, are vulnerable to these effects.
And I was wondering, because we've had all this wildfire smoke in recent weeks, how much of that gets inside and how much of that is going to impact the indoor air quality as well?
Yes. And we know that even though we try to protect and to have our homes airtight and well sealed, not all homes are airtight and sealed. You at some point need to open the door and go out. And so some of that outdoor air comes indoors. And it also depends on the infrastructure, how old your house is, how, well sealed everything is. And so there's a huge divide in socioeconomics also. And so people that are typically more impacted by other environmental things also are impacted by this. Because if your home is if you don't have air conditioning, in Baltimore weather in the summer, it's really hard to not open your window to get some flow of air. And so, yes, so it is definitely one of the things that we recommend for these wildfires is keep your house shut as much as possible, windows closed. But then you need like an air purifier inside your home or at least a fan to move the air around. Otherwise, it's really uncomfortable.
Ana Rule, thanks so much for joining me.
You're welcome.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.